Procedure we're going to follow is to hear from Dr. Gerberding, then Dr. Fauci, and then Dr. Heymann in Geneva. We very much appreciate joining us by satellite. So if we could start with you, Dr. Gerberding.
Senator Gregg, Senator Kennedy, we really appreciate this opportunity to appear here today. I think it's so important.
Global alert. In addition to preventing many health workers from becoming infected, we might be able to contain this disease as it was starting up.
Borders and the communication of it outside of their borders.
Let me start with Vietnam.
Give us a sense of what you're projecting as the spread of this disease. Number one.
I would say that what we have here is an epidemic of new virus or some virus that's causing problems in virtually every corner of the globe. We are controlling it primarily by identifying exposed and case patients and implementing public health measures to prevent spread. We don't know where this is going to go. If we're lucky, it will have a seasonal pattern and it will wane over the summer months, or maybe what we're seeing in the early stages is this large increase will level off. But we're taking it very seriously. We have to be prepared for this to continue to spread.
Yourself, the CDC, enormously important, but we see how rapidly that this
What's concerning about this disease is that it's a disease which has probably emerged from nature into humans, but instead of having a dead end in humans, in other words, infecting humans and not transmitting on, it continues to transmit through chains of transmission to health workers and then to their family and others. It's not a highly virulent disease. 4% is not a very high case fatality rate. But what is high is the fact that it's killing health workers who are the pillar of our society. So it is a very important disease because of that.
Mid-February now, just about getting into mid-April, over a 2-month period.
How does this microbe cause its pathological effect, the genesis of the pathology? And that's what we're going to be studying very intensively now that we have the virus, because we're not sure at this point whether it's the virus itself that's causing all the damage in the lungs of the individuals, or if it's the virus together with what would be a normal immune response, but in some diseases, the immune response itself causes damage. We have certain infections in which a certain type of an immune response can actually make the pathological effect worse. We've seen that in some cases of respiratory syncytial virus, in some cases of measles.
Following our recommendations, and there's been a great rallying around this outbreak in the 21st century as a new way of working. And I have to say that we didn't anticipate the support that we've had. We only